I didn't realise it was an issue at all until I went for my yearly mammogram. And the radiologist called me in and said she doesn't like what she sees. And I immediately sank. I literally sank into a chair.
I think the word cancer invokes fear in all of us.
See what I'm saying?
The fact that you're a woman, the fact that you have breasts, you're at risk.
You always want to be 100% sure.
I do think we have to be vigilant because basically 60% of all women who get breast cancer have no identifiable risk factors.
I'd always been very healthy. Exercise regularly. I eat very well.
You know when you've got somebody who does everything right?
6, 2, 3.
Exercise, healthy life, yes, family history, and lo and behold, develops a small little cancer.
Long, tall, black. You know, I wasn't traumatized at all. I just thought, okay, I'm going to make a decision, and I did.
Technically today, 9 out of 10 ladies with breast cancer are alive 10 years down the line. It is a very manageable disease, particularly if managed in a multidisciplinary environment. So here I run a unit of 16 or 17 specialists. It's specialists who comes from different hospital groups, so there's independents. There are specialists within every aspect of breast cancer, meeting in our unit 3 times a week.
Maybe a path care review on that.
So it's radiologies, it's nursing sisters, medical oncology, radiologists from different units, pathologists from different pathology labs, surgeons, reconstructive surgeons.
And I just want to see why she's actually just completely drained and she sailed through her chemotherapy. Like
we generally will all sit down and we will discuss each and every case.
And that's to give your input and more importantly make a treatment decision with consensus.
What is developed is a bent of research, nice articles, a camaraderie, a respect, which is so good. It happens all over overseas because there's not this small pond concept medicine, which I think is so sad in this country.
Convinced her? Yeah. Fabulous.
Our healthcare system is almost unique in the world in how fragmented it is. So if you look all around the world now, health professionals, and I mean GPs and specialists and different kinds of specialists and nurses work in an integrated team.
When I first set up multidisciplinary, some people in private said, she's too anxious to make decisions on her own. True. Absolutely.
I saw her a week after because I'm so anxious. After she stopped everything, her flushes are worse. Okay, so I said, well,
there's so much knowledge and information out there, and I'm fortunate in that I'm really privileged to be working with people and exposed to what I consider cutting edge from breast management.
New ideas around radiation therapy.
Because typically a healthcare problem, especially a complicated problem, can never be solved by one professional.
And all cases are not straightforward, and you can get it from all the different specialities.
Wonderful. More heads, better than one. I thought to myself and said to myself all the time, I'm in such brilliant hands, the finest.
Beautiful central.
And that was it. That actually really put my mind at rest.
Which is around the muscle.
So we work in a team of surgeons.
Got 1 or 2 more glands here.
We would remove the tumour either via doing a mastectomy or a lumpectomy, and then we would continue and do the reconstruction immediately after that. We have a pathologist in theatre that will have a look at the tumour, make sure that we've got it out with an appropriate margin, and then we will continue with the reconstruction.
Okay, scrub it, Batman.
Oncology reigns supreme. Nobody died of a breast cancer. It's of what cancer can do elsewhere. So that's why the value of multidisciplinary. Should the patient be starting with an operation, or should the patient be starting with chemotherapy? When you're doing the operation, does the patient need radiation, yes or no?
Thank heavens I fell into that category. So I needed no radiation or chemo. Now I'm thrilled. I really am.
What she epitomizes for me is the glass is half full. You know how there's certain people who just look at life and say, you know what, they've given me lemons and I'm making lemonade.
I'm so lucky. I really am. And that's actually what stood foremost in my mind, that how lucky I am.
Why are you so lucky?
Because it was caught so early.